Good evening, everyone. I am Dr. Shabnam Sultana from GS Research Center, Guwahati, and I am the host of today's webinar. Welcome to our webinar on approaches to cancer prevention, integrating modern oncology and ancient Ayurveda. So, as you know, cancer is one of the challenging medical condition in whole worldwide, and but the good news is that it can be prevented with early detection and awareness. And February being the month of cancer prevention month, it reminds us that awareness and early detection and action can actually save lives of many people. So today we have two esteemed experts with us, Dr. Mainak Chakraborty and Dr. Divya S. Starting my introduction with Dr. Mainak Chakraborty, he has done his MBBS and Masters in Surgery. He is a distinguished surgical oncologist with extensive training and experience in complex oncological procedures. He has performed over 250 complex oncological surgeries independently and managed chemotherapy and cancer-related emergencies. He has worked on various prestigious hospitals like Tata Memorial Cancer Hospital, Medica Superspecialty Hospital, etc. Currently, he is working at Saroj Gupta Cancer Center and Research Institute as consultant oncologist surgeon. And Dr. Divya, ma'am, she has done MD Ayurveda in Panchakarma. So she's currently working at DS Research Center, Bangalore for the past 7 years. She has a total experience of 14 years in Ayurvedic practice. She has also worked in some of the highly prestigious Ayurvedic hospitals in Bangalore, like Nimhans, MS Ramaya Hospital, Satayu Ayurveda, etc. So, ending my introduction with two esteemed experts with us, I would now like to dive right into the topic of cancer prevention. So, there are a few questions generally pops up in our mind whenever we hear the word cancer prevention. So, I want to start this session with the first few questions with Dr. Chakraborty, sir. Sir, I want to know, and people wants to know actually, in this as this February month is a cancer awareness month or cancer prevention month. So, in this cancer prevention month, the first question generally pops out or comes in mind that why is cancer prevention so much important these days, and does early action really helps in the prevention of cancer?
Am I audible?
Yes, I'm on. Yes, sir.
So the question is that how can a person live his life fully without having cancer? It is that's the thing
Yes,
because with time, what is happening? The survival of people are increasing. Initially, the average age of people who is going to survive was in the range of 45, 50. Now, with a lot of modern advances, people are considering surviving up to 80, 100, up to 100 probably. But there will be things like with advanced age, there will be more and more environmental pollutions and food pollutions that we are. It is going to affect and it's going to cause some changes in our system. As you all know, cancer happens when a mutation anywhere in your body happens, and more than 90% of time it is because of some spontaneous mutation in a person. 10% times it could be hereditary. It can happen from your parents or from your family history, but 90% of time these are sporadic, and it happens just like that. You don't know, it's just a chance factor. You become unlucky, there is a mutation, and that mutation adds up, and then a cancer develops. So, to prevent cancer, one must know what are the mutating factors in environment, in your food, and if you can avoid those, as well as to for prevention, definitely there are some screening mechanisms by which we can detect early in our body if there's cancer or not.
okay, sir. Sir, what are the main risk factors that for cancer that people should be aware of in today's era? Like, what are the main risk factors for cancer?
So, considering if we see the spectrum of cancers, in female, the most common cancer, as we can see, is breast cancer. And in male, it can be prostate cancer and lung cancer. Apart from that, in the northern belt, where I used to work in BHU in Uttar Pradesh, you can see the head neck cancer is very high. As well as in the Gangetic belt, you used to see that gallbladder cancer was very high. So there are definitely some geographical factors are there, as well as certain habits factors are also very much involved. because head neck cancer happens because of continuous use of oral tobacco. And any place where there is a continuous use of oral tobacco, the chances of cancer will increase. Whereas in northeast and in this part of the country, in eastern part of the country, the chance of lung cancer is high. And if you go deeper, you will find that people smoke a lot in these places. Whereas in Kerala, you will find chances of esophageal cancer, stomach cancer is high. And if you go deep, you will find they drink a lot alcohol. So the thing is that there are certain preventable factors in every part. And if you go to the geography, if you see what kind of their dietary habits are and what kind of environment they're living in, and air pollution is certainly taking part because it is definitely taking its toll on human body, and it is increasing in all the metro cities. The air quality index is way high up the charts, and even if it is not taking toll immediately, it is definitely going to take toll within next 20, 30 years. Because with all those microplastics and all the environmental pollutions are going in your body, we just don't know how it's going to act, how it's going to mutate all the cells in our body. And the third thing is that the dietary habits. The Ayurveda used to teach us what should be the ideal diet, and they also had classified like this is the sattvic diet, this is the tamasic diet, and this is the rajasic diet. But in our current scenario, I would like to say that all the processed food that we are taking in, all the machine-made food that we are taking in, they are actually the tamasic diet. Okay, don't think of having a chicken stew or boiled chicken or egg as a tamasic food now. If you are taking something from packet, a food that you are giving your child who is opening up the packet and starting to eat, this is not a natural food. And from the very young age, if you are feeding them processed food, then we are actually throwing them into all those big corporates who are mixing a lot of stuffs. If you see the packaging, there will be so many additives and so many things you don't even know the names of those additives. What are they adding, right? People
Sir,
are now coming up with,
okay.
yeah.
Sir, I wanted to know, like, does age is also considered as a risk factor for cancer? So,
Age is definitely a risk factor. With it's like at 80 years of age, you have almost 80% chance of having a cancer. This is age is always there. It's almost like at 40 years of age, you have obviously not 40%, but the more you age, 70 years of age, you have almost 70% of chance of having any form of cancer. And if we don't do autopsy regularly, but in US, UK, they do regular autopsy, and out there they do find cancer with normal patient who has died of age. They have a prostate cancer, they have a thyroid cancer. It does not just manifest. Cancer will inevitably happen to you because of the whether you are the atmosphere you are staying in with all the environmental pollutants and factors is there. But obviously there are many mechanisms now by which we can actually screen up. If you are coming to the third point of
yeah.
what I can do, what I can do to protect myself, definitely consult a dietitian, consult a Ayush doctor or dietitian doctor or the health provider who is going to give you the what is the ideal way to eat and what is the ideal way to stay healthy. Definitely, I think Dr. Divya is going to speak on that with her experience on this Ayurvedic field of so many years. But as a cancer surgeon, with my limited experience, I have been practicing for the last 5 years in cancer surgery. Before that, I was just practicing general surgery. But I did my MCH from IMS BHU in 2019. And then I was at Tata Memorial, Tata Hospital, Mumbai. And then I'm doing my independent practice. And the only thing that patient asks me whenever they comes to me, like at the age of 50 years or 45 years or 60 years, doctor, I was very healthy. I didn't have any disease on me. Now you are saying that I have a cancer. How is that possible? So
Yes.
then I asked him that did you had any investigation prior? Do you know that you were suffering from high cholesterol for 10 years or diabetes for 5 years? So he says, no, doctor, I have never done any blood investigation. I have never done any echocardiography. I have never done any ECG. I have never done any ultrasound. So this is the wrong way of approaching in your lifestyle, right? There is always a screening method that has been very documentedly explained that at the age of 30 years, you should have this basic amount of blood test, this basic amount of investigation done. At the age of 35 years, you should have this test done. At the age of 40 years, you should have this test done. Because until and unless you do one ultrasonography, once ever, you have to do one ultrasonography, even without symptom, and you might find out something that might help you preventing a future cancer. or a woman at the age of 40, even if she doesn't have any symptom, should undergo one mammography
Yes.
at least once in a 5 years. And that will help her. Even I'm saying that even sometimes they don't have any symptom, they don't have any lump, but a mammography might pick up something. And if they undergo investigation, they might pick up something in a very early stage, in stage one.
Mhm.
I
Yeah.
can quote one Chinese study that happened during the COVID times,
Yeah.
where people were routinely being screened during COVID for thoracic CT scan. They were undergoing high resolution CT scan just to find out some ground glass opacities for, for COVID scoring, like whether they have some lung damages because of COVID. And at that time, they really found out that the diagnosis of very early stage lung cancer was getting picked up in the early stage, in the earliest of stages, where a simple focused radiation would cure the patient.
Yes.
So we need to more and more focus on what are the various screening methods available for
Yes.
various cancers, and if we can implement them, and you can educate them, the
Yeah.
people, that okay, you see, you spend lots of money in lot of luxuries and lot of food and everything. Also invest, procure some money every month. That okay, after this age, or 35 or 40 or 55, I will invest for myself. I will spend some 20,000 and I will do all the tests that are required, because these tests might help you to detect something. Even if you don't have any symptom, it might help you to detect something, and that will help you out. It's not only for cancer, I'm telling you. If you do an ECG, if you do an echo, if you do a lipid profile, you might detect something. If you do randomly, if you do a
Okay. So this is a very important information from you, sir, that screening is very much mandatory for every age group. So that, especially not for cancer, for other diseases, at least they will get to know. Because most of the people or most of the patients, whenever they come to clinic, they just wait. Sorry, sir has left the meeting, I think due to Wi-Fi problem. So I'm coming now to you, ma'am. I have very few questions to discuss with you regarding in this cancer
Hmm.
prevention. Okay, sir. Uh, Okay, sir. From last conversation, I get to know that screening is very much important for cancer prevention. So we should put much more focus on cancer screenings, all the modern screenings methods for detecting cancer at early age. And the last question I would want to ask and end this webinar with you: how can people stay updated on latest development in cancer prevention?
uh, okay, so in cancer prevention, I would only say that don't follow WhatsApp University. Okay, so whatever messages that you are getting of any modern cancer treatment, some magic miracle drug has come, or some vaccine has come and it is going to cure everything, or somebody is saying 100 rupees medicine or pill has developed, and they arbitrarily add up somebody's name, somebody's celebrated name that he is suggesting, he or she is suggesting. Don't fall in those traps. Okay, whenever you are having a genuine question, always ask a genuine person who is actually focused on this kind of facilities. You just cannot believe somebody saying anything.
Yes.
Okay, and in the age of artificial intelligence, getting a knowledge is not that difficult, because artificial intelligence is not going to give you like any WhatsApp University. It's not going to give you any false ideas. So if you have a genuine question, you can always ask the whatever you Bing you have or Chat GPT you have. You can ask them. They might guide you because they have good knowledge, better knowledge than those fake newses. And definitely, but they are not going to give you the exact knowledge. So if you have some doubt and queries, you can always definitely, you are always open to consult a specialist, especially in this field, who is dealing with cancers. And on updates are very complex. Okay, cancer itself is a very complex thing to understand. It's not that simple thing. And every cancer is different from the other rest one. You have to understand, a liver cancer is not same as a gallbladder cancer, which is not same as a pancreas cancer, which is not same as a spleen cancer, which is not same as a stomach. It's not same as a colon, and its colon is not same as a rectum. Everyone is different, and their management is also different. The medication that they take is also different. Chemotherapies are also different. Surgical techniques is also different. It's a complex thing. So, and also Ayush is taking part. I would also suggest here that Ayush is a complement, but it cannot be a replacement. If somebody say that I am going to cure your cancer by giving Ayurvedic or homeopathy medication, that's a very wrong notion. So
Yes.
it's my request to all of you, all the listeners and all the doctors, that always counsel them that it is an adjunct. Like if somebody is not being cured by allopathic medication or immunotherapy or something, then one can take up certain naturoveda or some alternate medicine as an adjunct for a better lifestyle. But if somebody is giving somebody a false claim that, okay, you don't take chemotherapy, you don't do surgery, but I will cure you with some Ayurveda, I'm going to cure you with some homeopathic medications, that might harm the patient. Because if sometimes the tumor is operable, then the best thing is to remove it from the body rather than to give some medicines.
Yes, sir.
Right. So that's my point that I wanted to protect. And I can also add up one thing, which is like you are saying that staying updated. There
Yeah.
are certain new things are coming up, which are very exciting. And within the next 10 years, that might change the way people are being treated in cancer. Out of which one thing is for the screening part. I will try to be as layman language as possible, but there are certain epigenetic modification that happen when a cell is undergoing cancer transformation. And this epigenetic modification is known as DNA methylation. And DNA methylation can be captured by, like, if you know, in a gene expert, where we used to identify whether a blood sample is having tuberculosis or not. It is the test is known as CBNAT, which is a cassette-based amplification test, where you just put the tissue sample or the blood sample, and within half an hour, they tell that whether this tissue sample or a blood sample does have any tuberculous gene. And
Okay.
based on that, because initially we used to wait for to check for acid pass bacilli or to do one-two tests, but they were never very focused. But CBNAT has been proven for the last 20 years. CBNAT has been proven to be very effective. Now, this CBNAT technology, the same technology of amplification, we are just trying to find out. It is if I am not very wrong, it is a John Hopkins and Mayo hospital-based study that is going on, and some pilot study has also been done in South Africa as well as in China. And they have found there are a lot of screening mechanisms that could be found out, where a simple blood draw can identify, because all cancer cells, as we all know, they are systemic. In breast it happens, or cervix it happens, or liver it happens, it will always going to throw up cancer cells in your bloodstream. And as we know them as CTC, or circulating tumor cells. So in your blood, there will be some circulating tumor cells, there will be some circulating DNA going on. And if we can capture those blood samples and test them just to check for those methylations, if they match, then we can actually say, okay, this patient is having higher chance of having this cancer or that cancer. That's one thing is coming up, where a single blood draw is going to find out whether you have a cancer or not. And second is about this Russian vaccine that they have told, the mRNA vaccine. mRNA
Yeah.
vaccine was not in vogue till 10 years back. It came to be known as when the, I think, when the America and I think mainly America, the US, the Pfizer, they actually brought out this mRNA vaccine for the first time. Okay, and the Pfizer, the vaccine that Pfizer they came up with was the only mRNA vaccine that was there in the market. And in India, we didn't have mRNA vaccine. Okay, in India, those two vaccines were actually killed virus vaccines. Whatever we had, the Covid Shield and whatever we have taken. But this mRNA study, it got huge boost during the COVID times. How can we send the mRNA inside your body to reproduce the similar symptoms just like the virus, and immune the body, teach the immune system of our body to fight against that virus. So that same mechanism is being tried for cancer cells also. So it is a very, very, very huge prospective study. and Russia is going to do some human trials within the next 5-10 years. So we are very much highly motivated that well, some sort of vaccine might come in future, and this is not a fake news. This is actually true news. That is
Yeah.
the thing I can tell.
Yeah. Thank you so much, sir. Thank you, sir, for your valuable time and sharing this valuable knowledge about cancer prevention through modern perspective. Thanks, and have a great day, sir.
Yes,
Thank you.
thank you, sir. Thank you. I would like to take the leave, but I wish you all the best.
Thank you so much, sir.
Thank you.
So, coming to you, Dr. Divya, ma'am. Sorry,
Yes.
hope I was a little bit off. So, here are some few questions. Actually, I have. Like first question I would want to ask you, like, how does Ayurveda view cancer prevention differently from modern medicine? So, can you share some Ayurvedic herbs or practices that have shown promising results in cancer prevention?
Okay. So, first of all, Ayurveda is a life science. So, more than a medical science, it is a life science. So, the main focus is on the lifestyle, which is the root cause for almost all the diseases, including cancer. Cancer is a metabolic disorder, which is again dependent on the lifestyle. So, if we have to look at the Ayurvedic perspective of prevention of cancer, then Ayurveda works on the root cause of the disease. So, if you think about the root cause of cancer, what is the root cause of cancer? Number one, long term accumulation of toxins in the body. Number two, compromised immunity. Number three, uncontrolled stress levels. These are the basic causes for cancer, that is the root cause of the cancer. Now, let us see how to handle this root cause in Ayurvedic way. First thing, accumulation of toxins in the body. So you have three ways by which you can clear this toxin accumulator. First is to avoid the intake of toxins. So it is an external toxin. It can be tobacco, alcohol, or the artificial colors, polluted air. So anything that we are taking from outside inside the body, so that can be avoided if we put a conscious effort. So this is avoiding the toxins entering the body. This is the first thing. Second is to improve the digestive power. Digestive power in Ayurveda, we call it as Agni. So if we strengthen the Agni, if the digestion power is good, it will not allow the accumulation of toxins in the body. So whenever the toxins enter the body, it is thrown out of the body. It will not allow the toxins to load inside the body. So we need to strengthen the Agni. And then we have Ayurvedic herbs, which, when taken on a regular basis every day, that improves the, I mean, that also reduces the toxins. And we have certain detoxificatory therapies that is called as Panchakarma. Detoxificatory therapies, which removes the toxins from your body and reduces the toxin load and also reduces the risk of a person ending up in cancer. Now, then comes the compromised immunity. So, anybody with a very good immunity, in spite of having a lot of addictions, they don't end up in cancer. So, people say there are many people who smoke for so many years. I don't do anything or like that, but still, why me? The reason is immunity. As long as the immunity is good, cancer doesn't express itself. When the immunity drops for various reasons, the cancer will get expressed. So even if the disease is there, you can make sure that the cancer is not expressed if the immunity is good. So cancer is an immune compromised disease. How to improve this immunity? Again, you have 3 points. Number one, proper healthy diet, which are antioxidant rich on a daily basis. It has to be taken. And then a regular moderate physical activity improves immunity. And again, Ayurvedic herbs, which on a regular basis, if you take, that also improves immunity. Then comes the uncontrolled stress level. So, a fine balance between body, mind, and spirit is what Ayurveda believes in. So, yoga, pranayama, and meditation helps in handling your stress level so that it doesn't go out of your control. So, these are the principles on which Ayurveda works on in preventing cancer in particular. And if we talk about herbs, Ayurvedic herbs which can be helpful in preventing cancer, the first thing that would come to our mind is turmeric. Yeah, it is a strong anti-inflammatory and anti-cancerous agent.
Yes.
Then you have ashwagandha, which reduces the stress levels, improves immunity. You have guduchi, which is an immunomodulator. You have amla, which is the richest source of vitamin C, and vitamin C is a strong antioxidant. So we have neem, which is a liver protector, blood purifier. So these are the common Ayurvedic herbs which most of us know, which can be taken on a regular basis as a preventive aspect for cancer care.
Okay, my second question will be, what advice would you give to someone looking to adopt a cancer preventive lifestyle from Ayurvedic point of view?
So, in lifestyle, for prevention of cancer, there are certain things which needs to be added in the daily routine. There are certain things which needs to be deleted from the daily routine. So, let us talk about what needs to be deleted from the daily routine. Okay, so there are three whites: sugar, salt, and maida. Okay, white sugar needs to be avoided. Instead, you can use organic jaggery or honey as a sweetener. The regular salt, it is better if you can replace it with Saindava Lavana, that is rock salt or Himalayan pink salt. It has more of medicinal quality and it is anti-cancerous as well. And then you have maida. Maida is a refined wheat flour which is devoid of fiber, and this is said to cause colon cancer. So maida needs to be avoided. Now, maida and white sugar are part and parcel of all the bakery products. So bakery products needs to be avoided. In order to avoid chemicals like food colors, processed food, more of fats, more of salt, and used oils, so it is better if you can limit the intake of hotel food.
Okay.
Deep fry food. Again, when food is deep fried in oil, so it releases free radicals which are cause for all the diseases, including cancer. And this oil should not be reused. Once deep frying is done, that oil should not be reused. If you keep reusing the oil, that becomes carcinogen. So that needs to be avoided. Red meat is a cause for cancer. This is a proven fact. So these things needs to be avoided. And now, what is it that you can add in your daily routine? Okay, so you can add 30 ml of amla juice every day in the morning, which is a rich antioxidant, helps in building immunity and preventing not just cancer but many other diseases also. You can take 1 glass of ashgard juice with little lemon and salt, because ashgard is an alkaline, is a strong alkaline food. So researchers have proven that in acidic medium, cancer cells grows, and in alkaline medium it doesn't. So we need to add on more of alkaline food in our daily routine. Ashgard is one of the strong alkaline food. So 1 glass of ashgard juice in the morning, empty stomach, will be helpful in prevention of cancer. Then aloe vera. Aloe vera juice 30 ml can prevent stomach cancer, and people with constipation are also benefited with that. If aloe vera gel gargling is done, it can prevent oral cancers. If barley water is taken on and off, it can prevent anorectal cancers. And then if you take sugarcane juice, tender coconut water, and hydrate yourself well, it can prevent urinary bladder cancer. And vegetables like bitter gourd and neem, they are all liver protector, so they can prevent liver cancers. You can keep water in copper vessel and drink that water regularly. So the ionic copper goes into the water and it strengthens the colon muscle. This helps in preventing colon cancer. So these are the things which you can add on into your daily routine. And most important is you need to add more of alkaline food which are highly antioxidant in property on a daily basis. So this is how you can change the lifestyle with a moderate physical activity and a controlled stress levels.
Okay, ma'am. Thank you, ma'am, for like, because in today's generation, the lifestyle part has become a major big issue for many diseases, not only cancer. Because in today's generation, we generally want shortcut and when in everything. So I think people will be benefited from this video, I hope. And my last question would be, how can integrating Ayurveda with modern oncology improve patient outcome?
Integration of Ayurveda and allopathy is going to benefit the patients to a greater level. The reason is the modern oncology is actually doing exceptionally well when it comes to acute conditions like handling pain. Severe pain is handled very well. Severe bleeding is handled very well. So when there is obstruction, clearing the obstruction by surgical interventions like putting stunt in it, and surgical interventions when it is about removing bigger tumors. So these areas, the modern oncology is doing really very well, clear, and reducing the tumor size through radiation or chemo or any other treatment protocols. So it is doing exceptionally well when it comes to acute conditions. And now Ayurveda plays a major role once the scan becomes normal. Avoiding the recurrence of the disease is something Ayurveda is doing exceptionally well. It improves the quality of life in patients who are undergoing chemoradiation, because the Ayurvedic treatment is going to give the tolerating capacity for the patient to handle these chemoradiations so that the side effects are less expressed and
Yes.
the body fights back. The response of the body to any treatment he takes, be it allopathy, Ayurveda, homeopathy, any treatment you take, if the immunity is good, body's response will be good. And recovery from the side effects of chemoradiation will be faster in those patients who are with our medication. So, in this way, avoiding recurrence in the future, improving quality of life, extending life expectations, and then fastening the recovery period, giving tolerating capacity for the patient to withstand any harsh treatment that is given from any system of medicine. So, these are the areas where Ayurveda works exceptionally well. Short term results are important, long term results are also important for a patient. So for short term acute conditions, allopathy does really well. For long term and chronic results, chronic cases, long term effects, Ayurveda does exceptionally well. So if we both the system work together, the cancer patients are benefited more.
Yeah, ma'am. This is a very much needed information, and because Ayurveda and modern, if because when a patient suffers from cancer, they want to they have both different perspectives, whether they want to start modern treatment or whether they're confused between these two perspectives, whether they want to start modern treatment for their cancer or Ayurvedic treatment. So if both treatments if they continue both the treatment, it is much more beneficial for them. But even in some patients, I have seen, or many patients, whenever they come in my clinic, just tell me that they are very much more benefiting from Ayurvedic treatment, post chemo radiation or post chemo and radiation. Because what happens in modern is that they treat the disease, but apart from treatment, there may be side effects. So Ayurveda gives a shining hope to all the cancer patients, where through this treatment people are given that immunity, which was lost back, which is long lost, and secondly, it prevents disease recurrence, and thirdly, it increases the life expectancy of the patient. So this is a very good, much needed information in today's generation, because
And
most of the
public
people think that
also, yeah. Huh.
most of the
Public
people
is
think that
also a
Ayurveda
little
is
scared,
yeah,
hmm.
you can continue,
Okay.
ma'am. Like
So public is also scared, like if we take Ayurveda and allopathy together, there would be some reactions, some problems. I would like to make this point very clear. Ayurveda, allopathy can be taken together as well. There won't be any interaction between the two system of medicines, because in DS Research Center, we there are many patients who take both allopathy Ayurveda, and we never say not to go for any other treatment, because there won't be any interaction between the two system of medicine. And DS Research Center, it is not one medicine for all cancers. So there are specific
Yes.
medicines for specific cancer, and the medicines are designed for specific diagnosis. And the
Yes.
Ayurvedic herbs which are added in DS Research Center medicines are they work on targeted organs. So if there is kidney
Yes.
cancer, so the drugs, the herbs which are used, they go act directly on the kidney. So if it is liver cancer, the medicine is different, which acts directly on the liver. So it is basically acting on the target organs, and it is not one general medicine for all cancer. So we are very specific about the diagnosis, and that's the reason the results expected will also be more positive and quick.
It's a personalized treatment for every cancer patients in DS Research Center, which is very inspiring for every cancer patients. So thank you, ma'am. So with this, I want to wrap up this webinar session today. I really appreciate your presence and your giving us the valuable time and knowledge regarding cancer prevention in today's era through Ayurvedic perspective, which is much needed. And hope to meet you in the next webinar if I get a chance to host again. And I hope people have benefited through this webinar. Thanks and regards to you, and have a great day, ma'am.
Thank you. Thank you.